Teria joins us with more. Now, Ohiming, you've been observing the vaccination process and you were at this news conference, Ohiming. What more is there to report?
Yes, Daniel, there are 4 districts currently where the exercise is ongoing, and out of these 4, there are 36 centers, providing the vaccination care to residents in these districts. These districts are what health authorities describe as hotspots for COVID-19 in the region. They have been the driving force behind COVID-19 figures in the Ashanti region. Let me also say that Dr. Emmanuel Kojotinkran, the Ashanti Regional Health Director, has been touching on the fact that the region has, for the past 3 weeks, experienced some marginal decline in COVID-19 cases. 3 weeks ago, the region had over 1,335 cases. But as at now, the region is doing in the region of 800 plus cases. So he says the health authorities in the region has been doing everything possibly right. For instance, they've been doing contact tracing with sensitization campaign to the people, and then as well as testing more. And with this, he believes that if the residents in the region will support the efforts of health officials by adhering to COVID-19 safety protocols, especially with hand washing under running water with soap, and then the wearing of face masks, then this will go a long way to help bring the COVID-19 cases down, especially in the 3rd wave being experienced in the Ashanti region. But despite the numbers, cases coming down, the region in the last 3 weeks has recorded an increase in the number of COVID-19 fatalities here in Ashanti region. The region has done not less than 47 deaths, or has seen 47 deaths in the last 3 weeks, bringing the number of COVID-19 deaths in the Ashanti region to over 394, an indication that, yes, the regional health director also touched on the fact that COVID is still real and is killing people. So residents in the region should be wary and also adhere to the safety protocols being put out by health authorities.
Right. Now, Ohiming, away from the general safety protocols that have to be administered by the public, what about the vaccine rollout proper? We understand 11,000 different people have been given the jabs. Run us through the latest that we have as of now.
Yes, with the 11,000 people who have so far been vaccinated in the Ashanti region, the region received 50,400 doses. So if we have 11,000 people already vaccinated, then it means with the last few days to come, there's likelihood that there will be shortage of the vaccine if, for instance, people decide to troop and rush to these centers. The regional health director also touched on the fact that, yes, we don't have enough doses in the region. So those who are at home waiting for the last hour before they can be vaccinated should take note that we don't have enough doses. And he wouldn't be surprised to see that the vaccines, which are already in short supply, cannot feed the entire population or those who need them. He mentioned the fact that there has been some lapses on the part of the citizenry. For instance, he mentioned there was a health worker who did not take opportunity of the first and second phases of the vaccination exercise to be vaccinated, and he's among the 47 people who have died in the last 3 weeks. So he's encouraging people to be vaccinated. And as at this morning, when I monitored from these vaccination centers, in some instances, there were no queues at all. The places were empty with health officials, waiting for people to come and then for them to be vaccinated. So he has also, thrown more light on the fact that those who received the AstraZeneca, first shot of the AstraZeneca vaccine are also out there. They are anxious to be vaccinated with this Johnson & Johnson vaccine. Right. And it's something that the regional health director spoke against, that we will encourage those in that regard to wait for their turn. They shouldn't be anxious. They shouldn't go to these vaccination centers to be vaccinated because they don't know what the effect could be on their health.
Thank you very much, Ohiming Teria, for bringing us those details from the Ashanti region.